Uh-oh. Good?
It was fun.
Yeah. That's nice. Was it nice there? Because the wind kind of quit. The day before, man, it was terrible.
Yeah, no, it was.
We were off that water. It was just
5 hours in one coat.
40-mile-an-hour wind, just consistent. You said how long?
4.5 hours.
For what? Were you crappie fishing? Yeah.
We didn't start catching them till 6 o'clock.
They say they're catching up. They're catching with Fort Scott, which is typical about this time. I don't know.
It's nice out now, ain't
It's gonna be hot today.
it? Yeah.
I just sent it.
Okay.
81.
Supposed to be 100 degrees.
Expecting it.
Okay. He's done a good job.
Yeah, he's upstairs.
Okay.
I haven't talked to Bird, see what the status was down there of COVID-19. They've been.
Hey, Doug, do you have a copy of one of the, what we did our order?
The original one or
Yeah, I
the
assume
one
we're gonna
she's
go
got
over that.
now? We're printing it up.
Okay.
Right now. For some reason I couldn't print from my computer. I had to send it to Bob.
Oh, that's you.
You can't read my expression. I like it.
We'll have to rely on your eyebrows instead. So if you can just focus everything up there, that would be helpful.
When you sat, you look kind of blue.
Maybe a little.
I don't know about blue, but I bet you're tired.
I am a little tired.
Used to have a jazz band in town called Kind of Blue.
Kind of blue.
Kind of Blue. Be there. Hi, girl.
Ready to start this?
Yeah.
Are you ready to start, Don?
Yeah.
Says the copies are done. Do we need those first?
Well, if,
Might help to
That's
go
fine,
through.
I'm just-
Is that what you're gonna wanna do, Rebecca?
What?
Go through the order?
Yeah.
That's the, governor's funds. That's ours, okay.
Okay, thank you.
Thank you. Oh, perfect. Cool.
I did print me one out at home last night.
My head's too big.
I love that. I asked my husband if he wanted one, he's like, no, I do not want one. That's great.
You see that on back more I heard probably might be.
You ready?
Yeah.
Call this work session to order Friday, May 1st, 2020. Begin with flag salute. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Rebecca, thanks again.
Yeah, good
Yes.
morning.
Good morning.
So what I have emailed to Dawn and what I brought was, I don't know if everybody was able to watch the governor's, I don't know, press release yesterday. I guess that's what you call it. But anyway, so I didn't, I'm sorry I wasn't able to print out a bunch of copies, but I was at home, so it was kind of hard. But anyways, what I've emailed him, I did take our draft document. A lot is already included in her order. So I didn't feel like I should just retype her whole order into our draft document, and Jim is the expert on documents, so he can tell us what adjustments we need to make there. But I did put in things that we are allowed to be more restrictive, and actually there were just some things that weren't listed in the governor's orders that we had in our plans, our preliminary draft. So I have added that. And then I also emailed him the entire phased opening plan from the state. That's a large document. I don't know, we probably do not have time to read through that today. So it has recommendations. So what I wanted to focus on today, if it's okay with you, is just the phase 1, what's going to happen May 4th.
Okay.
I feel like, I don't know, with our draft document, I don't think we need to make that an official document or anything like that. I think we could just work from it and use it as we move along to make adjustments as things hopefully progress and put it into orders. If there's things on there that we don't want to use as things go on, we don't have to. I just don't think it needs to be an official document. I don't know what Jim thinks on that. Our draft that we had the other day, I don't think it needs to become an official document, or does it, or can we just use
If we want
orders?
to add extra items when the governor's placed in the order, I think we do need to have an official order for the extra things like.
Right, like this order, but I mean like the draft that we had, just as a working document, does it have to be officialized in any manner? Or,
It's something officialized if you want to be more strict than the governor.
so this order, what I have would be sufficient, like, to work off of the
Yes.
order? Okay. I was just thinking to take the old one off the website. Is that okay? Okay. Because really, that was really just ideas, and we knew that it would have to change. I feel like you can never plan too much, so I'm thankful that we have something to kind of go off of. But I think that the phases could change in the future, so I'd just like to do one at a time, if that's okay. If we just do one at a time, because I
No,
think
that's
it's going to
smart.
fluctuate a lot, and we really still don't know what's going to happen in 2 weeks. So I think what I'll do, if it's okay, and I know we have YouTube watchers and things, I'll just go through the governor's order and then go through what I've added on an order for the county. Does that sound okay?
Yep.
Just, I'll go through that. I'm not going to read the whole first page here with the whereas. That's just describing the situation like in every order. So on page 2, just starting on number 1, of course, above it, it says the governor has the authority to pass these orders. So number 1, her stay-at-home, or her statewide stay-home order, 20-16, 20-24, that extended the stay-home order, and the mass gathering order 2025 are no longer in effect. So this is going to take the place of those on the 4th. Number 2, mass gatherings of more than 10 individuals are prohibited. Mass gatherings are defined as instances in which individuals are in one location and are unable to maintain a 6-foot distance between individuals, not including individuals who reside together, with only infrequent or incidental moments of closer proximity. Number 3, guidance for individuals. Individuals are strongly encouraged to follow guidance attached to this order. Guidance for employers and businesses. Employers and businesses are strongly encouraged to follow guidance attached to this order. And number 5 are the business restrictions. All businesses not prohibited below can open if they comply with the following: maintain at least 6 feet of distance between customers or groups of customers. Restaurants or dining establishments may meet this requirement by using physical barriers sufficient to prevent virus spread between seated customers or groups of seated customers, and follow fundamental cleaning and public health practices, which is on the Kansas website. Avoid any instances in which groups of more than 10 individuals are in one location and unable to maintain a 6-foot distance, with only infrequent or incidental moments of closer proximity. This does not limit the total occupancy of a business, but requires that businesses limit mass gatherings in areas and instances in which physical distancing cannot be maintained, such as at tables, in entrances, lobbies, break rooms, check-in areas, etc., checkout areas, etc. All businesses in operation should follow industry-specific guidelines as provided on the KDHE website. Following any additional best practices, guidance from each business sector is strongly encouraged. So here's the following businesses that are not allowed to be open. The following, unless they are repurposed for use in an essential function under the KEFF as determined under the provisions of paragraph 7 below shall be closed to the public. Bars and nightclubs, excluding already operating curbside and carryout services. So I took that to mean for bars that are not restaurants.
So if a bar is serving food,
Right,
Then
they're a
they-
if they are a restaurant,
then
they are
they're
allowed to be open
They
under
just
the
have to
restaurant.
maintain the 6
Right.
foot distance.
But if a bar repurposes and becomes a restaurant,
Yeah,
then
it
they're
could-
also allowed.
Right, yeah. And there'll be a little bit more coming up down here on whose decision it is to decide that.
Okay.
It's really going to be more now the local, probably health officer decision.
Right,
Uh,
I know we're gonna need clarification on.
There's going to be a lot of questions, I have no doubt. So maybe,
Uh.
I'm hoping people will send some in today that maybe I can clarify right away. I have a few answers. So bars and nightclubs, they can still do curbside and carry out, because we're allowing that with the alcoholic beverages. Casinos, which are non-tribal, will not be open. Theaters, museums, and other indoor leisure spaces, trampoline parks, arcades, etc. So that is left pretty wide open. Fitness centers and gyms, nail salons, barbershops, hair salons, tanning salons, tattoo parlors, and other personal service businesses where close contact cannot be avoided. Okay, so number 6, education, activities, and venue restrictions. Educational facilities, K through 12 facilities remain subject to the provisions of Executive Order 20-07 regarding school closures, including the requirement that fewer than 10 students, instructors, or staff be present for normal operations. K through 12 facilities should continue to follow the guidelines of the continuous learning plan developed by the Kansas State Department of Education. Districts with facilities in more than one county or city should follow any applicable directives issued by the county and city in which their district office is located. Higher education facilities that are closed before May 4th should remain closed for in-person learning or events involving groups of more than 10 individuals present at a time. Licensed child care facilities may continue operations pursuant to state and local regulations. All activities and venues not prohibited in subparagraph 6.c below can open if they comply with the following. Maintain at least 6 feet of distance between individuals or groups, not including individuals who reside together. Follow fundamental cleaning and public health practices. Compliance with any additional sector-specific best practice guidance is strongly encouraged, and avoid any instances in which groups of more than 10 individuals are in one location and are unable to maintain a 6-foot distance with only infrequent or incidental moments of closer proximity. This does not limit the total occupancy of a facility, but requires that facilities limit mass gatherings in areas and instances in which physical distancing cannot be maintained, such as in entrances, lobbies, locker rooms, etc. The following, unless they are repurposed for use in an essential function under the KEFF as determined under the provisions of paragraph 7 below, shall remain closed to the public. Community centers, outdoor and indoor large entertainment venues with capacity of 2,000 or more, fairs, festivals, carnivals, parades, commencements and graduations, swimming pools other than backyard pools, organized sports facilities and tournaments, and summer camps. So on page 5, the essential functions, I'll read through that. It discusses essential functions. While local governments may implement more restrictive orders or provisions regarding businesses, mass gatherings, or stay-home requirements, local governments must continue to allow the performance of essential functions identified in the Kansas Essential Functions Framework. However, such local orders or provisions may affect or regulate essential functions only so long as they do not significantly disrupt performance of the essential function. The applicable list of essential functions was outlined in Executive Order 20-16 prior to its expiration. While the substantive provisions of that order no longer apply, the KEFF functions listed in Executive Order 20-16 are the essential functions local governments must continue to follow. During the reopening phases, whether an individual or organization performs an essential function under the KEFF is a decision left to local governments. But any individual or business with previous confirmation from the state that it performs essential functions under Executive Order 2016 prior to its expiration will continue to have those functions deemed essential. Nothing in this order shall restrict, limit, or supersede the Secretary of Health and Environment's authority to make isolation, quarantine, or other orders restricting movement as necessary to respond to escalating or worsening conditions in any local jurisdiction. local governments retain authority to issue and enforce equally or more restrictive orders or provisions, and retain any authority to issue or enforce isolation or quarantine orders or other orders restricting movement as necessary to respond to escalating or worsening conditions in any local jurisdiction. As currently permitted pursuant to state law, law enforcement officers enforcing this order should use their discretion, consult with their legal counsel, and consider the totality of the circumstances as they determine appropriate enforcement actions. In order to more accurately track and access statewide status of COVID-19 cases, private labs conducting testing for COVID-19 shall report both positive and negative tests to the Kansas Department of Health and Environment. The 4 tribes of Kansas, they list those out, retain any authority to regulate through their respective tribal councils for the health and welfare of their population. This order should be read in conjunction with other executive orders responding to COVID-19 pandemic that are still in effect and supersede any contrary provisions of previous orders. And it just says it'll be filed with the state on the last page there. So before we get a lot of questions, then I'd like to read what I have for Crawford County to work with this. I think hopefully it'll make sense. We're about to find out. Well, I have it in here somewhere. Maybe I didn't print that. Did you guys, did you print a copy of it? Yeah.
Is it this?
It's probably just waiting on my printer. Thank you. Awesome. Yes, that's it. Thank you. Sorry about that. So the governor's order will go in effect May 4th, of course, 12 o'clock in the morning, May 4th. And basically, I'll just read this and then we can go over it. The following recommendations and orders are put forth by the Crawford County Health Officer and the Crawford County Board of Health in conjunction with Governor Laura Kelly's Executive Order 20-29. Number 1, mass gatherings 10 or less, and I didn't want to retype all of that on here. I think we could just put to reference her order. Business restrictions, the below recommendations or requirements are to be instituted in conjunction with Governor Laura Kelly's Executive Order 20-29. It is recommended that employers screen staff for fevers and any symptoms of COVID-19 with a questionnaire at workplace entrance. It is recommended that employees wear masks at all times unless prohibited by other safety equipment. Move workspaces 6 feet apart to maintain proper social distancing between employees as much as possible. It is recommended to stagger work shifts and keep work cohorts consistent to reduce burden of disease should a COVID-19 case occur in the workplace. Telecommuting, working from home should be maximized and still recommended. Restaurants are encouraged to have customers make reservations to decrease congestion in lobbies. Self-serve beverages and food items such as salad bars and buffets are not allowed. Provide shopping cart sanitation supplies. Consider one-way flow of movement through store indicated by floor marks. Employees are encouraged to wear masks at all times. Hand sanitizer should be readily available throughout the premises. Marks should be applied to the floor in the area adjacent to each register to indicate where to wait for checkout. It is highly recommended that plexiglass or glass barriers be installed or remain if previously installed at checkout lanes. And enhanced cleaning should be done throughout the workday. And so then I just referenced her order to look at that in regard to businesses that are supposed to be closed, just because I didn't think we needed to retype all of that in here. Long-term care facilities really were not addressed in the state order, and so I left what we had in there: maintain social distancing as much as possible, adjust the layout of common areas, including dining facilities, to maintain the 6 feet between residents, perform enhanced cleanings daily, screen all employees for fevers and any symptoms of COVID-19 before they begin their shifts. Staff should wear masks at all times and no outside visitors. Licensed care facilities will just follow the state guidelines like the governor listed in her order. Recreation Commission activities, reference her order, it's basically not allowed right now. Parks, public spaces weren't specifically addressed. They are open, but I would like to keep the equipment closed and the picnic tables for the first 2 weeks. Public swimming pools are in her order, so reference that. Real estate, that will just continue as we have. Individual showings are allowed. No open houses. All parties are encouraged to wear a mask in public and maintain a 6-foot distance from others at all times. community events and activities and venues. I didn't list those out separately like we had cruising and things. I felt like her order covered basically anything that would be a community event or a venue. But I did add that the entity organizing the event is responsible for ensuring that all guidelines are being followed, and hand sanitizer should be readily available throughout the premises for the duration of the event, and then to reference her order for what is not allowed. Education is in her order. Acute care and non-acute care, I felt like it needed to be in here. I've had lots and lots of questions from dentist's office and eye doctor's office, and even the hospitals of who they're supposed to follow. So I just left that in there, that they'll continue to follow the CDC, CMS, and their licensing entities. Libraries were not specifically listed, so on page 3, I did specifically put that because I think it's a little confusing. So on page 3, number 6, if you go to actually B, okay. It's gonna actually be on page 4. Number 6 is on page 3, but then B is actually on page 4. So, all activities and venues not prohibited in 6C. So libraries are not prohibited at all. It doesn't list libraries as being prohibited. So I put that staff and visitors are encouraged to wear cloth masks, hand sanitizer is available to the public, and enhanced cleaning is performed. And then this just states that the Crawford County Health Officer, in conjunction with the Crawford County Board of Health, will reassess the above recommendations and orders at a minimum of once a week, like we had planned, to ensure that orders are effective and to evaluate for necessary changes. Weekly evaluations will take place during Crawford County Commission meetings. Additional county planning sessions will be scheduled on an as-needed basis. These meetings are open to the public. The above county order will also be adjusted as needed to ensure that it coincides with State of Kansas Governor's orders should those change, according to the State of Kansas plan to reopen. So that's all I had.
Okay.
All right.
I don't know. Well, and I've already had some questions last night because there's a lot of businesses that aren't listed in there. I had the bowling alley already reach out to me. They've sent me their plan, which is a really good plan. It's very robust. I also had the Axe Company. I can't remember the official name of it.
Main Street Axe Company.
They sent me a message on Facebook wanting to know if they're going to be allowed to reopen. So this morning I went ahead and emailed KDHE, one of the representatives there, and I did get an email back, and it just stated that anything that's not listed in the order would be up to the local government. So we would need to go ahead and I really think those are going to have to be decided case by case.
Right.
So, if you guys are comfortable with me looking at people's plans and making decisions on that, I'm fine with that. Or I can bring each
I think-
request to
yeah, I
the
think
board.
if you can-
I think so,
I think if
too.
they have a plan put in place to try to meet the guidelines.
Yeah.
And you're comfortable with their plan as meeting those
Okay.
guidelines, then yes. If you're not comfortable with their plan
Right.
meeting the guidelines, then maybe we need to
Look-
figure out a way to help them try to meet those guidelines.
Okay.
One thing I'll say on that is that when we did that last time, I think everybody needs to be in the loop on those.
Right.
So
'Cause-
that when you get a plan and you make a decision, we all know about it.
Sure.
We're not getting different questions, and we all
Right.
know what the plan is, what happened.
Right. Yeah,
If they look to you for approval's fine, it's just that everybody knows this is approved, this is approved.
Yeah, I think it gets very confusing for people. They just, they
Right.
don't know who to ask or where to go. So, yeah, I mean, when I get questions, I can just email it out.
So do we want to set up a protocol for that now? What that looks
Sure.
like, where they go? I mean, that's just to clarify, if you don't feel you fall in this list, here's how the chain of
Sure.
command of what it looks like. So we don't get, if they need to be calling you, there's no sense of all three of us fielding that phone call before you even talk to them.
Right.
No,
that's what was
yeah.
happening.
I'm
Yeah.
fine with if you guys get calls, just have them call the health department.
Okay.
That could be our
Yeah, that's
protocol.
probably what we need to do is.
I'd say we need to put it on the
when we get
website that
calls,
way.
right,
Yeah,
send it to Rebecca.
if they could,
Yes.
if you can put it on the website, any individual business questions, concerns. I mean, really, we haven't been inundated even before. We had a lot of calls those first few days when things were really moving quickly and changing constantly. But it was nothing that we couldn't handle, so, I mean, I'm happy to take those calls.
Well, and some of them, the way this order reads, when we went through and did that and determined they were essential or not essential, they're still
They're still
considered
essential, right.
So that we shouldn't have to refield
No,
those phone calls. It's
no.
just the ones that
No.
probably haven't been open.
I
what
think
that
we'll
looks
still
like.
get those questions, because I think it's, sometimes reading documents like these are difficult and confusing for people, but yeah, so if they're already deemed essential, then they don't need to go through any process, they're still open. But, okay, so, yeah, if we could just put on the website that they'll email those questions.
So
or
individual-
Call the health department. Call the
Individual
health-
business not on the order will contact the health department.
Yeah, for guidance.
Did we ever determine, Jim, about the bowling alley? I know Mr. Lynch had,
Yeah, I emailed the state this morning about the bowling alley, and they said any business that's not listed on there, it's up to the local
It's up to
government.
us.
and I know that they serve food.
I got
there
his
as well.
plan, he emailed it to me last night, and it's very, very good. It's very
Okay.
thorough, they have a cleaning process for all the bowling balls, and they also have a restaurant in there. I mean, their restaurant's able to be open according to the guidelines set forth in the governor's order, but does that sound, I mean, I thought the plan they had was very good. And
So right now, that's-
I'm fine with it being open, and I was gonna call him personally. The Axe Company, I have to call them and talk to them. He sent me a message just saying they have a good plan. I haven't seen it yet, so
Okay.
I'm gonna call him too.
Likewise, I guess let's talk about repurposed for essential functions, because that's
yeah.
the loophole here.
They can be, yeah.
So what does that look like? Are you gonna field those calls as well?
Yeah, that's fine.
Okay. I mean, I don't wanna
No,
throw
I'm
it all
fine
on you, I'm
with it.
just, but that's,
Well, I want to make it as simple as possible for people, you know, it's just, one thing I will say is, you know, I am glad to see that, ours went pretty well with, close to the governor's. I mean, there's some things that we were gonna allow that the state's not gonna allow, and there was some things that we were gonna be a little more strict on. But I think this is a good way to start. And if people are not sure and they think they can do something different with their business, I don't have a problem with that. I mean, you know, businesses have to operate, so if they feel like there's a way they can meet, if they want to have a restaurant, if, you know, they'll have to go through the Department of Agriculture to set up a restaurant.
Right.
Because there are guidelines on things like that, so, but if somebody says, hey, we're going to start making face masks, or, you know, I mean, all they need to do is call and I'll walk through it with them. It's
Do we
fine.
need any clarification on churches?
No, they would just be like any other venue. And they're, as far as I know, that they're following the guidelines for any, no different than any other business or venue, so, or
so if they're doing
activity.
social distancing,
Right.
they're,
There's
From
a
the way I
protocol.
understood, they're not considered separate from like any other business would be, or activity. In the governor's order, let's see what, I don't know what page that was. Well, there's been a lot of discussion around churches. It
page
has-
4, probably.
Yeah, it's been recommended, you know, that they would be under the category just like any other business. Page 3, number 6, education activities and venue restrictions. So activities, all activities and venues not prohibited in 6.c, and churches are not prohibited. So I would assume that they would maintain at least 6-foot distancing, follow the cleaning, and avoid any instances in which groups of more than 10 individuals are in one location and unable to maintain a 6-foot distance. So just like in other businesses, like stores and things, if you can keep people 6 feet apart, you know. That's why I did not add anything additional in there for
Right.
churches.
And just to clarify, just like the restaurant setting, if you're with your family,
Right.
you're next to each other.
I
but
did like-
The
another
next table has
The
to
next
be.
group.
Yeah,
6
and I
foot
did
away.
like, they did say that you should avoid more than 10 in a group, so that does, because we had that question, what if 20 or 30 people go in together and want to sit at a table? You
Right.
know, so I did think that would be helpful for people, but yeah, as long as each family or group is 6 feet apart.
Do you foresee any other surprises?
I don't know. No, I don't think so. Now, I plan on reading this. It was just late last night, you know, this whole reopening plan. What I thought maybe we could do is, of course, and I didn't put phase one or anything like that. I got a lot of calls that was very confusing to people. Like phase one is now, and then phase two is the next 2 weeks, and phase three. So I just put the date on it, because her order, I mean, we don't know. Her order could change in a week. It may not be 2 weeks. It will not get more relaxed any sooner than 2 weeks. But, you know, there are things that could change if we start having a lot of activity with disease and things like that. So I just put the date on it, and then we'll have to reevaluate as we go along. And I thought maybe we could do that next week on Friday, just we would have had a whole week. And then maybe come up with some sort of a plan document that we could have ready when it's time to move to phase two with the state. Because I think it could change off and on throughout the phases, just like we have already, you know, throughout the last 2 months. But I am willing to do whatever you guys want to do, too, so.
What about inter-county travel restriction? Is that?
It's still not recommended to restrict travel within counties within Kansas and
What's the
require
reason for that?
quarantine. Well, the reason for that is that a lot of people work across county lines. And then a lot of people, like if we wanted to restrict going up to maybe say Johnson County
I was
or
going to say,
Wyandotte.
could we do county specific?
You can. The only issue is that a lot of people go up there to see specialists like cardiologist, oncologist. So what we've seen happening is that some people are putting those appointments off even though they need to go, because then when they get back, they don't want to quarantine for 14 days. So it just becomes an issue when people start to put off needed health care.
Right.
Because we are limited in our area as to what people have access to. And it's also been seen, we're not as close to Sedgwick County, but I know some of the administrators up there are having the same issue. Some have said you can't go to Sedgwick County, and well, you can go, but if you do, you have to quarantine when you come back. And so they're having people who are like, well, I'm not gonna go see my oncologist and get my meds refilled. Or, for example, we have the Ryan White program, and those are individuals who are HIV positive. They have to go up sometimes to KU. That's the only place to see the doctor. And so if they don't want to be quarantined for 14 days, that could become a really bad situation for those folks. And the other part is too, it's just almost impossible to police. Because even with the interstate travel that we have the quarantine on, there's just no way to make people call and tell you that they've gone. We have some that do, they're just honest, you know, and they do, and they want to do the right thing. Others are just, they're not going to, they're going to just kind of do what they want. So
Right.
my only concern with that is the fact that people may not get needed medical attention out of fear that they're going to have to quarantine for 14 days when they come
Right.
back. So.
That's understandable.
And in the governor's guidance and order, you know, I believe it's in the guidance document, it recommends that people still travel as little as possible. And that's still something we want people to do, is stay home as much as possible and wear the masks. But anyway, that's kind of why. That's why. And in the commission meeting, I'll have some announcements too. There's some new states are added onto the travel quarantine list, and some have been taken off. So as far as I've heard, Kansas is not on a quarantine list for other states at this point. So, yeah.
Okay. I'd also had a call this morning with the director of the Pittsburgh Public Library, who was concerned because libraries are included to open in phase one, and she was like, there is no way that we would be able to do that safely.
Right. Well,
So she said that they would be willing to remain closed even if we allow for it
sure.
in the order. I mean, is it worth including in there then that
Well,
libraries,
they're
she's
quite-
like, we can go to curbside in a couple of
Sure.
weeks, but we can't do that
Well,
right
there
now.
are other this order is not forcing anyone to open.
Right,
I think it's
anybody.
important for people to understand
have
that.
a choice to
But there are
say
some
close.
very small communities that the library is, in Arma, the library is the food bank. So there, and I know Gerard, the library is a place a lot of times for children to be and get some constructive, guidance and activities and things like that. We've done a lot of things with the Gerard Library. So I didn't want to hinder libraries from opening if they wanted to. By no means would a library have to open if they didn't want to. That could be an independent decision that they make,
Sure.
With their administrative board or whoever regulates them. Some are city libraries, some are private libraries. So I would just say that would have to be an individual decision. I just hate to limit it because in some really small communities, the library really is the hub of a
Right.
lot of what happens.
Sure.
And ARMA is a great example with, they have
Yes.
a small, but they have a food bank there, so.
Okay.
Any questions?
Do we have any questions online or anything?
We don't at this time.
Okay.
Just looking.
Sir, did you have any questions?
I'd like to make a comment to add to
If
your
you-
thought process at some point.
Okay, if,
Sure, I'm,
Yeah.
that's all I have.
First of all, thank you very much for your time and allowing me to be here. So, a couple things. One of the questions
sir,
was,
could you state your name?
yeah, it's Mark McLean, Drop the H Brewing Company in Pittsburgh. The restaurant versus bar question, I can't speak for every municipality in the county, but I know in Pittsburgh they delineate that, and every month they look at our records between alcohol sales versus food sales to determine which of those criteria we are. So that may already be determined, so you may not have to go over that. I think you gentlemen have a great opportunity to show some leadership for the entire state. And sometimes one of the best things to do is to have the circumspection to do nothing. So you're not required, that I'm aware of, to add or amplify the governor's edict. I don't think any amplification is necessary, prudent, or helpful. So let's just look at Crawford County. 5 confirmed cases, 2 hospitalizations, 0 deaths. If you look at the state website, and I'm not trying to make light of anyone's death, anytime someone passes away, it's a tragedy for their family, their friends, etc. But 125 people in the entire state. The youngest was 42, the oldest 99, and the average 81 years old. The average life expectancy for someone in Crawford County, according to the CDC, is 76.6 years old. So the average fatality in the state is 5 years better than you'll do if you're an average person living in Crawford County. And for that, we are irreparably harming our community's economic and welfare and the quality of life for a lot of our people. I don't know that that's necessary or prudent or desired. So any amplification that we add above and beyond this is bad. Now, the opportunity that I would suggest to you gentlemen is saying no amplification and imploring the governor to let individual counties make their guidance. Because let's say we continue to do great work and have no more cases, no fatalities, et cetera, in Crawford County. But one county, perhaps a part of Kansas City's metro area, has an increase. Right now, the governor is using a one-size-fits-all statewide policy. What may be good for that one county should not be applied to everybody equally. I don't understand that, and I think it is a false premise that we've bought into, and I think we ought to try to take control of the local economy back to local folks. Thank you very much for your time.
Thank you.
Thanks.
Yeah.
Well, and I will say, I didn't announce it yet, because I usually do it in the commission meetings, but we had another case yesterday. So, we actually had 8 cases in Crawford County, 6 confirmed positive, 2 presumptive, and we've had the 1 death, so. And I would just like to kind of add on to that, add just a little bit, that we're not restricting any businesses from opening at all. Actually, our original plan was less restrictive than the governor's. We wanted every business to be able to open in some capacity. And these recommendations that I have put forth as the health officer are guidance from the CDC, the federal government, as well as other infection control specialists. I don't think maintaining a 6-foot distance will impede anyone's business. Many of the things in our order are recommendations, because as the County Board of Health and the County Health Officer, it is our duty to give recommendations to reduce the spread of any disease, including COVID-19. So I do think that the community needs some sort of guidance. The governor strongly recommended that local governments put into place any other guidance that they felt was necessary, because hers is a blanket policy. And we just don't know. You know, we don't know what's going to happen in 2 weeks. If we have a case like Southwest Kansas, where there are now over 700 cases, it will shut down our economy. If we have 700 cases of COVID-19 and all of their contacts have to quarantine for 14 days, it'll shut down our economy, because most cases have 20 to 30 contacts. So what's 700 times 30? All of those people would have to be quarantined for 14 days. So what I've listed in here is not necessarily things. It's important to delineate the difference between a recommendation and an order. A recommendation to have hand sanitizer available is prudent. A recommendation to have enhanced cleaning is prudent. Having markings on your floor to make sure that social distancing is easy for people to understand and remember is prudent. Encouraging people to protect themselves by wearing a mask, encouraging, not requiring, is prudent from a health standpoint. Providing shopping cart sanitation supplies, I feel, is prudent. I don't feel like any of this is directly saying you must do this. In Crawford County, no one's been fined ever throughout this entire pandemic. No one's been cited, no one's been ticketed. I feel like I have advocated for those businesses, like the bowling alley is an example. They have a robust plan to open. If I did not do that, they just wouldn't be able to open. I
Right.
mean,
Well,
they
that's-
wouldn't. If we did not look individually case by case, it's not that simple just to say, do nothing. If we do nothing, the businesses that aren't listed on here will not be able to open. So I want everyone to be able to open in some sort of capacity. I do not want any business to have to close or file for bankruptcy. And I feel like the other issues that are on here, the only things that we've listed are real estate. That would continue as it had been. And if there is a one-on-one issue that a real estate agent has that they would like to address, I would be more than willing to visit with them. And if they can make prudent adjustments that protect the people looking at a house or a property, I would be happy to work with them. So I don't feel like any of our requirements in anything that we've recommended or asked for in this document is going to keep any business from opening or being able to operate. And the fact that the governor has orders is nothing we can control. Those we are required to follow. It's my duty as the county health officer to do that. And I will also just state, by state statute, as the county health officer, I have the right to pass these orders on my own. And I choose not to do that because I don't feel like anyone in government should work unilaterally. The County Board of Health, I want to do it in conjunction with the County Board of Health, but by statute, I do have the legal authority to pass these types of orders on my own. And I think it's important just to remember that I've been very, very transparent, and as a nurse practitioner for nearly 25 years, and soon to have a doctorate in public health, I think it's important that we base how we're going to approach a deadly pandemic through a evidence-based manner. I just think it's important. I know it's very hard to manage economics and health at the same time. Throughout history, with everything, you see Tobacco Clean Air Acts. I mean, there are things over time that have been very controversial with managing health and economic stability and people's rights, but no one has the right to give someone else a disease that will kill them without some sort of prudent action to try to prevent it. I don't have the right to get up close to someone who does not want to be gotten up close to. I do not have the right to, well, to put it bluntly, to smoke in a restaurant in the state of Kansas because other people have the right to clean air. People have a right to be protected to a certain extent. And I'm sure that's very controversial, and I'm sure it's very debatable. From a health standpoint, though, that's my job as the county health officer, to make recommendations that protect people's health and welfare and safety, and also to try to have the best economic stability that we can have. And I feel like we've tried to do that all along. So I don't feel like anything we're recommending here today, and I would love to hear comments. I'm more than willing to hear comments. If there is a certain business that it is felt that our plan would impede their business in some way, then I would be willing to listen to those comments.
Well, unfortunately, we're not just approving what we put together last
Right.
Tuesday. Because,
No, that's never
I
been
mean,
approved.
right, because
Yeah.
that would allow everyone to open in some capacity. what
Yeah, we
had-
wanted to open
What
everything
we
in
had
the
put
county.
together,
Right.
but right now, there's definite, there's so many places closed, and I don't know what we could do. We can't do anything about it.
No, we
It's
we
directly,
cannot
the
override
only
the
thing that
governor's
they have the
order.
power to try to repurpose that, but I don't see how a barbershop repurposes their business.
If
to
a
be
barber shop
open.
called me and said, I'm gonna put a restaurant in my barber shop, I said, you need to call the Department of Ag, and when you get a restaurant license,
Right.
I will be happy that you can be
So,
open.
yeah.
I wish that every single business in our county
I
could
do
be
too.
open in some sort of capacity, and I think that our draft document proves that you three as the county commissioners and myself as the health officer have tried every effort to make sure that every business could have been open in some sort of capacity. We have no control, zero, what comes down from the state. I am on KDHE calls every single day and have commented that I feel like we are at a level in Crawford County that we can safely open all of our businesses, but that is not up to me, and it's not up to any of us.
It's our call.
Yeah.
We do have some questions
Okay.
that have come in by email.
It says, just to clarify, is Rebecca saying that if someone goes to Johnson County upon return, they need to quarantine 14 days only if they develop or have symptoms? No, that was, thank you, Dawn, but no, that was a question. Jeremy had asked if I recommended that, and I said no. If we do that, that's going to just impede some people from wanting to go to see their doctor and do important things like get medical care. So no, we are not recommending any quarantine for interstate travel within the state of
If
Kansas.
they do develop
So,
symptoms,
now,
yes,
if
I'll
someone
do it.
would develop symptoms, they need to call the health department and we'll screen them for testing and that kind of thing. But I do not recommend, and I'm not going to put into place any kind of travel quarantine for within the state of Kansas.
I was thinking there was. This one, what about youth sports? What is the-
Right, that is thank you, Brady. That's actually in the governor's order. And so it's not allowed right now, per the governor's order. Sports are not allowed.
I think that maybe.
This is
everything we've got.
Is this 2 weeks? Sorry.
Well,
Her order? is
her order is open-ended in her phased plan. Her phased plan, I just want to remind people too, this is a guidance document, this large reopening plan. The order is the actual one that I read off of.
Right.
It doesn't have an end.
It does not have an end date at this point. So, it does state that they're going to be reevaluating things, and that's why I do not want to do anything in advance of this.
Right.
You know, but I would like, and I think it's important too to remember that it's in our document to meet every week. We can meet more often, we can meet every day if you want to, and look at how things are going. I just think it's important for people to remember that if we do have a large outbreak, I feel like things could become more restrictive, not necessarily at a local level, at a state level even. So that's why it's prudent to maintain social distancing and wear the mask, wash your hands, because we don't want to reverse. We don't want to go back. This 2-week period is a testing period to see what's going to happen with our numbers. The state numbers went up significantly yesterday. We did get a case yesterday. The states all around us are increasing in cases. So, it's just using prudent common sense to reduce the spread of this so that we can continue to open and get our economy back on track, and also protect the health and wellness of all of our citizens, especially those that are 60 and over, and those with other health issues. And I will say too, there's a lot that's not known about the virus. The more that's coming out, there are a lot of younger people that have not only died, but there's a significant amount of mounting evidence that those with COVID-19 with severe illness are having strokes, losing limbs, a lot like meningitis. The inflammation response within the body becomes so severe that you have inflammation that causes it's called DIC, or an intravascular coagulation, and a clumping of blood cells that then can float around to your body, to your brain, to your heart, to your lung, to extremities. And people are having amputations because of that kind of thing. And I don't, and in their 40s, 50s, and 60s, I'm 49, I don't want to have a stroke. I don't want to get sick. I don't want to see anybody experience that, and that's why we have to just use prudent common sense to continue to use some very, very, very easy, minimal recommendations of distancing, wearing masks, washing our hands, and just protecting one another. It's not a matter of someone telling someone else what to do. It's someone choosing to do the right thing, choosing to protect their family and their friends, their community. So if we do the right thing for the next 2 weeks, things could go hopefully very smoothly for Crawford County, and we won't see those burdensome health outcomes that so many people, even in the state of Kansas, have experienced.
So just to clarify for those people on YouTube right now watching this, the timeline may not be 2 weeks.
That's right.
We don't know the end date.
Right. Now, for
the-
us,
for the governor's
for
order.
our order, if in 2 weeks, if things are going great, I'm never going to stop recommending that a business have hand sanitizer available, ever.
Right.
I am never going to say, well, I think it's okay now that we don't use hand sanitizer. That isn't going to happen. I'm never going to recommend that someone quit cleaning daily in their business.
Right.
I'm never, throughout this whole thing, I'm not going to say, I don't think anyone should wear masks anymore until COVID-19 is gone and we have a treatment and we have an immunization, or herd immunity would be great too, where no one's going to get it. I'm still going to recommend masks. Real estate, something like that, absolutely. If we're at a point where in 2 weeks we don't have any more cases, I would feel comfortable saying, okay, have some open houses. Let's stay 6 feet apart. But one thing too, and I'm not picking on real estate, there are some things we can do that doesn't require a lot of people in a place at one time in a small environment, and we can do it one-on-one. If someone has an issue and really can't do that, call me. I'll be happy to work with them. For that matter, really, like the parks, if we have no cases in 2 weeks, I'd be like, okay, open up the playground equipment. But I don't think it's prohibiting anyone from running their business that the slipper slide's not open, to be real honest. It's not. It's just, you can't clean those things. I'm going to continue to recommend that businesses screen their staff. It is not something they have to do. It is a prudent, common sense recommendation that you would not want someone in your business with COVID-19 symptoms, because the health department is required by law to isolate those people, and then anyone around them has to be quarantined for 14 days. That would be detrimental to a business.
That's what I had to call.
That would close a business. If all of their employees were quarantined for 14 days and couldn't go to work, that could be the end to a lot of businesses. So, long-term care facilities, I've talked to several. They really want guidance. They have a lot of pressure to let people back in their facilities, and they don't want people back in right now because for the next 2 weeks to see what happens. You know, we put our loved ones in assisted living and long-term care to protect their health, not so that they can have a massive COVID-19 outbreak and have 30 or 40 people die from it. They are there to be protected. Regardless of what our beliefs are on how long one should live or quality of life, every person has the right to have a protected health and longevity, how they see fit. So we have a duty as the county government to give some solid recommendations at a minimum. And I think the only other one that we've said is self-serve beverages and salad bars, because touching high-touch areas, people who are coughing, even in good times, I've seen people go through salad bars that I'm like, I'm not going through a salad bar because people are touching that stuff. The spoons are falling in the food. This is a time where we don't need to put people at increased risk on high-touch items. And that's where cleaning comes in once again. So, but yes, to answer your question, Commissioner Blair, we'll look at this next Friday, and if there's something else that we can do, if we're getting a lot of comments like, hey, we need to do this and this and this, I do not know of any other county in the lower 8 that has been as transparent and willing to work with the community as us. Actually, in the lower 8, I've not heard of anyone else planning in a way where they're allowing people to ask questions and be live on YouTube. They're doing it with their few local leaders, and they're not really doing it per se on a large scale with the community, and I understand why. It makes it a lot more difficult, but it also helps people to realize that we care, we want to have their opinion, we want everyone to succeed. So I think what we're doing is good. I think it's good to include everyone. We are not required to do that. There is no statute that says we have to include anyone or take any comments. We could pass an order just like the governor did yesterday,
Yeah.
and that would be it. But we want to take comments and we want to include others.
Right.
So.
Okay.
And I thought we could look at this then and vote on it, I guess, in the meeting.
Okay.
And I will add that the health department needs to be notified with questions. We are going to get questions from businesses, so we have to have a process to answer those. And I'm happy to do it as the health officer. It is my legal duty to do it, so I will add that.
Is there anything you need to be able to do that?
No.
I mean, you have the staffing. You
No.
think the-
I plan
Okay.
on, if a person can find a way to be open in a safe manner, I'm fine with them being open.
Yeah. I think all of us are.
Good, yeah,
It sounds like you guys are comfortable with that, and I am too.
Yeah.
all right.
On a different note, how was your radio?
It was good.
Oh, it was really good.
Everything went
It was
well.
awesome.
I kept reiterating to people, all of this is going to change. And I feel as though all of this that we just discussed is going to change as well. And probably most of that will be out of our hands, just as we've experienced over the last several months. And the other thing I will say is, I think everyone, federally, state-wise, is trying to protect the health of citizens. Like we've discussed before, these are effects that the county's going to feel financially. I mean, these are effects we are all feeling financially.
Yeah.
I've had to close my own personal business. So none of us are exempt from experiencing the pains of all of this, but we still have to be prudent and use common sense when it comes to protecting one another.
Yeah.
Thank you.
Okay,
Thank
so
you
would
very
it be
much.
all right with you if I use Jim's computer and fix that and then come in after the meeting starts?
Sure. Yeah.
A little
I think
bit?
so.
Okay. All right.
Thank you very much.
Cool.
Oh, well, it's only 9 o'clock, but you guys are going to work with the.
We have another work
Department.
session.
So I'll
Got
just be a
elected
little late.
officials
Is that
in a
okay?
minute.
Yeah.
I'm a little late
Yeah.
coming in.
And conclude this.
Yeah.
Yep. Jim, you have
We'll
something?
to maybe run in shifts if we have more.
Right.
Right.
few
That's
people
fine.
at a time. So,
Let me see
So
what
it-
you wrote specifically. I want to use the word, can I have that? Thank
I don't
you.
know if you, don't say that's the.
I'm gonna use
Can you read it? Yeah.
Yes, you can read it. Okay, so we conclude this work session.
Yes.
I'll put the phone number.
We don't need a motion on that.
But I guess I-
Right, yeah, no.
Okay, so I guess our work session now is 5 minutes. recess for 5 minutes and then kind of get people organized how they're gonna come in and out. I don't know how many people in the hallway.
See how many we got?
Okay. So take recess till 9:05. Reconvene.
No, first wait, why don't we do elected officials?
When you look at the graph that came out with on the fourth stage, so the last stage is social distancing. So when someone reads that, they go for the rest of our lives. Do you think we're going to keep 6 feet this week? Kind of makes high school dances, et cetera. And I'm not trying to say we should improve about people's lives. But the original forecast is 2.0 deaths by a professor, International College of London. He's got a 20-year record. All his guys, it's going to be about 60,000 probably. Which is about a flu season.
I'm not gonna discredit that, but right now, everyone's lucky that around here, you have somebody personally died. From the beginning, I predicted 2 things. 1, we'll get through it, or 2, we're gonna switch to the president this one lives from it. And right now, I'm happy with choice number 1. I am too. But we're working with the governors, I mean,
The reason I said we should try to is exactly what she's saying. So if one county in Kansas City, if the governor is imposing a statewide, here's the meeting. It's not trying to, the counties, if one county is a problem, the entire state.
if you would, please. I agree.
That doesn't make.
But same as counties, I think the county situation is, if, as a county, each city's gonna be different, has a different risk. And honestly, Pittsburgh would be the highest risk area in my mind, due to numbers and proximity. So we're restricting towns like Kepler and Girard that have decreased risk just as much as everyone else because it's a county thing. Much like the Keplers, they do the same thing. So the whole staging thing, you guys have to just work thing. You have to run that, kind of give it thing, but what else you gonna do?
Stop the street.
I didn't hear about it. It's
hard to stop the street.
It's a lot easier.
Soon we get back to normal, better off. But right now, normal, it's not gonna happen as long as we